Artificial methods. Oral contraceptive is a pill used to prevent pregnancy. It contains hormones that block the release of eggs from the ovaries. Most oral contraceptives include estrogen and progestin, also called birth control pill. Currently, there are three different types available on the market: the combination pill, the progestin-only pill, and the continuous use pill. The birth control pill is safe, simple, and convenient way to prevent pregnancy. It also has other benefits like reducing acne, making your periods lighter and more regular, and easing menstrual cramps. The most common side effects are spotting or bleeding between periods. This is more common with progestin-only pills. Sore breast, nausea, or headaches, but these usually go away after 2 or 3 months, and they don't happen to everyone who takes the pill. As with all medication, they do have some potential risks and side effects. This includes an increased risk of blood clots and a small increase in breast cancer risk. Transdermal patch. The transdermal patch has a combination of both estrogen and progesterone in a form of a patch. For 3 weeks, the woman should apply one patch every week on the following areas: upper outer arm, upper torso, abdomen, or buttocks. At the 4th week, no patch is applied because the menstrual flow would then occur. The area where the patch is applied should be clean, dry, free from any application, and without any redness or irritation. The advantage of transdermal patches deliver drugs directly into the circulatory system, bypassing the gastrointestinal system and avoiding the hepatic first pass effect. This delivery system is advantageous for the treatment of the depression with monoamine oxidase inhibitors. However, the patch is not a perfect means of contraception because of some drawbacks listed below. It does not provide protection against sexually transmitted infections, including HIV, and must be prescribed by a healthcare provider. The estrogen levels are higher with a patch than with other hormonal methods. Vaginal ring. The vaginal ring releases a combination of estrogen and progesterone and surrounds the cervix. This silicone ring is inserted vaginally and remains there for 3 weeks, then removed on the 4th week as menstrual flow occurs. The woman becomes fertile as soon as the ring is removed. The vaginal ring has the same effectivity rate on the oral contraceptives. The advantages of vaginal ring is it releases 15 mcg ethinyl estradiol and 120 mcg of etonogestrel daily for 21 days. This is lower than the dose of estrogen released by the contraceptive pill or patch, resulting in fewer side effects due to estrogen. The disadvantage. Apart from the side effects, the ring also has some specific disadvantages. Provides no protection against sexually transmitted infection. Must be prescribed by a healthcare provider. Subdermal implant. The subdermal implants are 2 rod-like implants embedded under the skin of the woman during her menses or on the 7th day of her menstruation to make sure that she is not pregnant. It contains etonogestrel, desogestrel, and progestin. It is effective for 3 to 5 years. Advantages of progestin implants include long-term contraceptive action without requiring the user's or provider's attention, low dose of highly effective contraception without the use of estrogen, and fertility is readily reversible after the removal of implants. Disadvantages. You may experience temporary side effects during the first few months like headaches, nausea, breast tenderness, and mood swings. Your periods may be irregular or stop altogether. You may get acne or your acne might get worse. Hormonal injection. A hormonal injection consists of medroxyprogesterone, progesterone, and given once every 12 weeks intramuscularly muscularly. The injection inhibits ovulation and causes changes in the endometrium and the cervical mucus. After administration, the site should not be massaged so it could absorb slowly. It has an effectiveness of almost 100%, making it one of the most popular choices for birth control. Advice to women to advantage. CAH injection lasts for either 8 or 13 weeks. It does not interrupt sex. It is safe to use while you're breastfeeding. It is not affected by other medicines. It may reduce heavy, painful periods and help with premenstrual symptoms for women. The disadvantages. Your period may change and become irregular, heavier, shorter, lighter, or stop altogether. This can carry on for some months after you stop the injection. It does not protect you against STIs. There can be a delay of up to 1 year before your periods to return to normal and you can become pregnant. Some people may put on weight when they use Depo-Provera or Cyanopress contraceptive injections. You may experience side effects like headaches, acne, hair loss, decreased sex drive, and mood swings. Any side effects can continue for as long as the injection lasts 8 or 13 weeks and for some time other. The risk. There's a small risk infection at the site of injection. In very rare cases, some people have an allergic reaction to the injection. Intrauterine device. An IUD is a small T-shaped object that is inserted into the uterus via the vagina. It prevents fertilization by creating a local sterile inflammatory condition to prevent implantation. The IUD is fitted only by the physician and inserted after the woman's menstrual flow to be sure that she is not pregnant. The device contains progesterone and is effective for 5 to 7 years. A woman with IUD is advised to check the flow of her menstruation every month and the IUD string, and also to have a pelvic examination yearly. Advantages. It protects against pregnancy for 5 or 10 years depending on the type. Once an IUD is fitted, it works straight away. Most people with womb can use it. There are no hormonal side effects such as acne, headaches, or breast tenderness. The disadvantages. Your periods may become heavier, longer, or more painful, though this may improve after a few months. It does not protect against STI, so you may need to use condoms as well. If you get an infection when you have an IUD fitted, it could lead to pelvic infection if not treated. Chemical barriers. Chemical barriers such as spermicides, vaginal gel and creams, and glycerin films are also used to cause the death of sperm before they can enter the cervix, and also lower the pH level of the vagina so it will not become conducive for the sperm. These chemical barriers cannot prevent sexually transmitted infection. However, they can be bought without any prescription. The ideal fail rate of chemical barriers is 80%. Pros of chemical barriers. It is easy, available, and affordable. Condoms can prevent the spread of STDs when used properly. Cons. Effectiveness as a contraceptive is compromised when the condom is damaged or not used properly. Using a male condom requires a pause just before the sex act, resulting in people foregoing using it at all. Diaphragm. A diaphragm works by inhibiting the entrance of the sperm into the vagina. It is a circular rubber disc that fits the cervix and should be placed before coitus. If a spermicide is combined with the use of a diaphragm, there is a failure rate of 6% ideally and 16% typically. The diaphragm should be fitted only by the physician and should remain in place for 6 hours after coitus. It can be left in place for not more than 24 hours to avoid inflammation or irritation. Advantage: you only need to use a diaphragm or cup when you want to have sex. You can put it in at a convenient time before having sex. There are usually no serious associated health risks or side effects. You're in control of your contraception. Disadvantage: it's not an it's not as effective as other types of contraception, and it depends on you remembering to use it and using it correctly. It does not provide reliable protection against STIs. It can take time to learn how to use it. Putting it in can interrupt sex, and the latex and spermicide can cause irritation in some women and their sexual partners. Risk: there are no health risks associated with using a contraceptive diaphragm or cup if you use it according to the instructions that come with it. Cervical cup. The cervical cup is another barrier method that is made of soft rubber and fitted on the rim of the cervix. It is shaped like a thimble with a thin rim and could stay in place for not more than 48 hours. Advantages: the cervical cup does not contain any hormones, can be used by persons who are breastfeeding, offers privacy and control because it can be inserted before intercourse. When placed appropriately, the cervical cup is often not felt by either partner during sex. Disadvantages: higher failure rate compared to other types of contraception, including the diaphragm. Can increase risk of toxic shock syndrome. Can increase risk of urinary tract infection. Must be used with spermicidal cream or gel. Must be available at the time of or inserted prior to sex. Require proper insertion technique which can be difficult for some people. Does not protect against STIs. Cannot be used by people who are allergic or sensitive to silicone and or spermicide. Cannot be used during menstruation. Male condom. The male condom is a latex or synthetic rubber sheet that is placed on the erect penis before vaginal penetration to trap the sperm during ejaculation. It can prevent STIs and can be brought over the counter without any fitting needed. Male condoms have an ideal fail rate of 2% and a typical fail rate of 15% due to a break in the sheet's integrity or spilling. After sexual intercourse, the condom is removed to be disposed. Prevents pregnancy. The first and most obvious benefit of condom is that it is highly effective means of preventing pregnancy if used correctly. It is also effective against STDs. Disadvantages of condom. Some people are embarrassed to use condoms or feel they may be interrupted for play or intercourse. Condoms may decrease sexual sensation. Condoms may break or leak. Some people are allergic to latex. These couples should use condom made of polyurethane. Female condoms. These are also latex rubber sheets that are specially designed for females and are pre-lubricated with spermicide. It has an inner ring that covers the cervix and an outer open ring that is placed against the vaginal opening. These are disposable and require no prescription. Advantages. Female condoms helps to protect both partners from STIs including HIV. When used correctly, there are reliable methods of preventing pregnancy. It is a form of contraception you can only need to use when you have sex. Disadvantage. Female condoms are very strong, but they may split or tear if not used properly. They are not as widely available as male condom as can be more expensive. Surgical methods. One of the most effective birth control methods is the surgical method. The two kinds of surgical methods are used by either the male or the female and would ensure